Welcome everybody, it's Dr. Bill Lawler. We're going to talk today about pregnancy and chiropractic. You might ask, what is it that I know about pregnancy and chiropractic? I do have 6 kids. My wife obviously did all the pregnancy part, but I was there and I did help each one of the 6 deliveries. I don't know how much help I was, I tried to be some help. More the experience of what I'm talking about is the 38 years in practice and seeing hundreds and thousands of pregnant women over those years, and actually actively looking forward to helping more pregnant women for a variety of reasons that we're going to talk about. So my clicker isn't working, so I have to reach around and do this every time, but that's okay, not that many slides. This is an outline of what we're going to talk about and kind of the why of it all. We will talk about infertility and chiropractic to start with, some ideas on that, on how and why we have worked to attract individuals, couples that cannot, have had a difficult time getting pregnant, and how chiropractic might help that. Kind of the basics after that. First trimester in chiropractic here, the fun and challenges of the first trimester. Then we go to the second. Webster Technique is usually the most vital in between that second and particularly the third trimester. We will then talk about the third trimester. Talk about labor and delivery, some things that we can teach spouses to do to be of help to the mommy delivering, and then why we recommend getting a baby checked after that. I did that on a previous video, and you can refer to that, but I'll also do one slide on that, and some of the things will be kind of obvious as we talk about the Webster Technique and then what that's trying to do to help the baby be in the right position. So, without any further ado, here we go. All right, infertility and chiropractic. How could chiropractic be of assistance in helping the both the woman to conceive, but also helping the man who is participating in the pregnancy, in conceiving? How could it help both the male and the female parts involved? So I'm going to grab one of my favorite little tools here, autonomic nervous system. We talk about this all the time. We show this to every new patient that comes into the office, and it is how everything is controlled by the nervous system. And as we as chiropractors work to help the brain connect better with the different organs, that is the major priority and way that we can help men and women that are having a challenge in conceiving, help both their nervous systems function better. Obviously, the lower part of the spine is what does connect directly to the ovaries, to the uterus, to the prostate, to the sexual organs that in fact are what are responsible for procreation and helping that happen. So I have seen, I think the number is dozens at least of individuals that were not able to conceive and were able to come into my practice. And I certainly have hundreds of colleagues that have attested the same thing, that have been able to help by working on getting that nervous system working better, getting the body functioning better, getting the brain communication better to the sexual organs, that they have actually been able to procreate and have children, which is an awesome thing. There is, if you do go online, there's a lot of information on this particular subject, and getting adjusted has helped many infertile couples to conceive. So would invite you to look at that as part of your protocol anyway, but particularly if getting pregnant has been a challenge. Next slide. Okay, here we go, starting into the pregnancy. First trimester. I have never personally experienced nausea and the lovely green phase of pregnancy, but I know many that have, and many that come in to see me have, and I definitely do, from my heart, express great admiration and gratitude for all you mothers that have weathered the storm and gotten through it. I know some women don't suffer as much from nausea. I did look up what I knew it was hormonally related, most likely, and the most likely cause appears to be HCG, human chorionic gonadotropin hormone that is kicked into gear as a woman is pregnant, and that's the first trimester is largely dealing with that. How can chiropractic help? I'm going to kind of beat the same drum, but same kind of idea is the better the nervous system's working, even during periods of incredible nausea or minimal nausea, can definitely help the body function better. I wish I could say getting adjusted will take that away. That would be an untrue statement. In some cases it has helped, it has eased it some, but it certainly has not taken it away, and I know some women struggle with that more than others. I was talking to another mother, we'll talk about it in sleep actually is what made me think of it, that just says during her pregnancy, this is her third, that sleep is a little more of a challenge. Goes to sleep okay, then wakes up and has a period in the early wee hours of not being able to sleep. And that's unfortunate on many levels, because obviously you're creating a person, human being is inside your body being created, and that's taking more and more energy as opposed to less and less. So that's the first trimester. Second trimester, often referred to as the best for many individuals, for many women, because things are, it's in between the two stresses of the hormonal changes and then the physical, more significant changes in the third trimester. So, just looking again, this is from a Mayo Clinic site. What's happening? Your body obviously is growing. I'm not sure the push-up thing against the wall must be to help stretch the calves, and I don't know what it has to do with pregnancy, but anyway, growing belly and breasts, uterus expands, belly grows. We're very careful never to say that a woman is getting bigger. We just say that the baby is getting bigger. May already start the contractions, Braxton Hicks, skin changes, nasal, dental, dizziness, leg cramps, vaginal discharge, all kinds of some amazing things. I'm making light of this and I apologize. It did say how identification or identifying signals or symptoms that you have twins. And I would say my short answer is all that, just kind of double it. But second trimester should be kind of when you're hitting your stride. The hormonal changes, your body's kind of gotten used to. The nausea hopefully has decreased. You are starting to change shape, obviously, but not as dramatically as when you get to the third trimester. So this is a time that hopefully you're catching up on sleep. Hopefully you're able to get sleep to get ready for that fun third trimester, and then obviously labor and delivery thereafter. But lots of things happening here, good things. Need to eat as well as you can. Make sure that I always have my water here, and I don't apologize for that. I am a water guy. I definitely think you should have water. I always drink filtered water. I don't drink it straight from the tap. We have a machine here at the office and also one at my house and other places I go. Good water is just essential for everything. And again, even more so in pregnancy, you need to make sure you're extremely well hydrated and that you're eating well. The better you eat, and I don't understand all those interesting cravings of peanut butter or Brussels sprouts or both together or whatever yours might be. I would love to have some comments on what your cravings have been or currently are during pregnancy. I find that very interesting and fascinating. Whatever my wife's were, we just went with it, and we're very appreciative of whatever it was that she wanted and tried to get her as much as she wanted. Okay, so we're going to take a little pause in the trimester talk, and now we're going to talk about the Webster Technique. I've talked about this before. You can look it up online. It was named for a man named Larry Webster that I was fortunate enough to get some instruction from and participate in some workshops from. He also founded what's called the ICPA, International Chiropractic Pediatric Association, which I've been a member of since the 90s. I'm pointing over there at a certificate. You can't see it, but it's over there. Anyway, and the reason why he developed the technique was he was at that point a grandfather and a grandfather-to-be when his daughters was pregnant and found that the baby was actually breech. And he said, obviously it's not good to have a breech baby. Well, I'll show you a slide in a minute that talks a little bit more about that. What is it that we could do? He talked to some other chiropractors, he talked to other midwives. What could we do to help that? Well, his theory was, and it's been now going on since the 90s, is a specific technique. Sacrum is very involved. The sacrum is the big bone behind in the pelvis. This one right here. This is the sacrum. These joints here, these huge joints are called sacroiliac joints, SI joints. We work on those on pretty much anybody that comes in here, from a little baby to certainly including pregnant women, because that's what we're talking about, to older people as well. These joints are under major stress. We're going to talk about that in the third trimester as well. But we often will contact one side or the other, and that's part of the Webster Technique. You can look up here. It talks a little bit more about that ICPA that I talked about. Hopefully you can see that link. If you can't, it's just ICPA for kids. And you can actually look up Webster Technique on there, and it actually will go into quite a bit more detail. It actually has a whole documented research with multiple references cited of the Webster Technique and how it works and why and so forth. But anyway, the first part of it is you have a woman lying down. We raise their legs to see if one side is tighter than the other one, and then we also have, raising the legs bended that way, and we also ask them to raise their legs as high as they can, keeping the legs straight. On the side where there's more pressure on the uterosacral ligament here in the back, there's always extra tightness, and that needs to be helped. I actually teach the spouses and significant others how to do that when they come in the office, and then have them do that above and beyond when they get their adjustments, the pregnant women do. But that's a major part of what we're doing, is we're working on that. Then we actually have the woman turn over on their back, and on the opposite side where the sacrum was involved, we look after the round ligament, which is on the side there. And we do a little bit of light pressure on that, and the whole concept is releasing tension on those ligaments. The next slide talks about that a little bit more. I just thought I would bring it up. I have assisted in over 100 babies being turned to the right direction. I've assisted in thousands of babies and pregnant women over the years, but specifically women who came in with babies in a breech, posterior, transverse, or some other combination thereof position, been able to help by relaxing those ligaments, and the body then figures out what to do and how to do it. So specifically now, talking about the different ligaments there's actually 5 that support the uterus. Broad and round, we talk a lot about those. The broad are the ones that goes around that way. Round is this one. Pubocervical obviously comes up from the subsist pubic bone. We're going to talk about that in a minute. Transverse cervical, and then uterosacral, which I just talked about, that one coming from behind going forward. So as we work to relieve the stress on the ligaments, then the baby can often turn to the right position. I just thought it was a key issue at this point. I'm going to grab my baby, so don't go anywhere. I should have had it with me. It's over here. So, the medical profession, their version, I didn't mean to use that word, but the way they would help if a baby was in the wrong position. So here we are, we're in utero, baby should be facing some variety of this. This would be posterior, this obviously would be breech if the butt's down first, transverse is this way. So any variation that's not correct, let's just say it's breech, since that's kind of the most severe. So the medical profession, what they would do is they would do what's called external version. So they would reach, the baby's inside the uterus, they actually would reach on the outside. They usually do it in office because it can cause a lot of issues. And they would try to find where the head is, the sacrum, and then they would, on the outside, rotate that baby around this way. Very forceful, very challenging, very difficult for mom, very difficult for baby. Chiropractically, we found a more simple version of that, and that is that the baby still is breech here. We don't do a lot with the baby, and we don't go after the baby at all. We don't do anything with the baby. We're working on the ligament here or here on mom. Going back not to mom here. We're going to work on that ligament, the sacral uteral ligament from the behind here. That's the primary contact. Working on the sacrum, helping that. and try to get that to relax. And literally something that we teach spouses and significant others to do, to actually help that relieve that pressure, relax that. Then, as I already said, we have the mom turn over on her back and the opposite side. So if we've done the right SI joint, then we check on here, a specific spot on the left where the round ligament is, and help that to also relax. Very interesting, because a lot of women have more pressure on the round ligament. Some people have it more, some women have it more in the back, some have it on both. But anyway, we work on that to try to help that to relax. And by doing that, I'm going to tell you a couple of stories here, but I've had women come in up to 39 and a half weeks, 40 weeks, and still be able to help that baby turn. Obviously, it's way better if a woman's getting adjusted during the whole pregnancy, but particularly from that second to third trimester, getting checked on a very consistent, regular basis every week is what I recommend throughout that pregnancy, because so much is going on. And particularly if they have other children as well, because they're lifting the other babies, and then they're getting, their baby is growing and changing things in shapes and dimensions. So the major things we do for pregnant women would be these SI joints. We work on them. We also do a contact without directly contacting the pubic bone. By using a woman's legs, we actually help to reset that as well. And a lot of women will come in actually walking, not a lot, some women have come in walking very awkwardly, kind of that pregnancy waddle, because there's so much pressure on the pubic bone. And by helping relieve that by not direct contact, by using leg contact, we actually help to reset that. So that's a huge deal in helping pregnancy and women. The final thing, well, let me tell the two stories, and I'll come back. My two stories. Beijing, China. You may wonder, what the heck is he talking about in Beijing, China? Well, actually, my daughter's sister-in-law was living in Beijing at the time. Baby was breech. She reached out to me through electronic means, and we did, at that time, a FaceTime. I guess that would be a Zoom or whatever. But anyway, and I actually walked the husband through. I tried to have him put his hand on the side joint here, and he was off on the hip joint. Says, okay, I'm glad we're doing this FaceTime. Anyway, he actually did what I taught him how to do, and sure enough, within a couple of days, the baby turned, was not born breech, and that was pretty exciting. The other one, I was at Seven Peaks Water Park in Provo, Utah, on a Memorial Day. It was a hot Memorial Day, and I heard someone yell my name, Dr. Bill, hi. And so I went over and talked to him. She was clearly quite pregnant, quite ready to say hello to the next baby. And in fact, I think she was due literally in 2 days. And so they said, don't you do something? Yeah, I do. Well, how do you do it? I said, well, the woman has to lie face down, and we actually find out if one side's tighter than the other one, and see if that's an indicator. And the husband said, well, why don't you do it right now? I said, well, I don't have a table. I said, well, there's an inner tube right there. Sure enough, this very compliant woman agreed to lay face down in the middle of all kinds of people. I checked her out. Sure enough, she had a positive Webster test. I did a little work there. She was able to come in the office the next day, and the baby turned from posterior to anterior normal. And so those are the two stories. So pretty exciting. Didn't have to be done that way. Most of them have been done in office. I wanted to just show you this. Kind of goes along with what I already said. Have breech position. You have posterior. They don't show a transverse, but that one's just all twisted in all sorts of not happy states. How challenging it is for the baby, in fact, to be born. There's so much pressure. We're going to talk about that in a minute. A lot of stuff going on. We'll get back to that. So, third trimester. Okay. I wanted to follow up on, obviously, weight does come on strong. We're just saying the baby's growing. We're not saying anything about mommy. And things are just changing. You could get cankles, the circulation changes, a lot of stuff is happening. Chiropractically, what's happening, or not chiropractic, but what we work on, the pelvis is loosening up so the baby can actually go through the pelvic opening, which is a good thing, but it also makes it less stable. So one of the things, we do have pregnancy pillows. I should have them in here, but I have a sort of a first, second trimester one, and then a bigger one where the mom can actually lie face down. There's plenty of room for the baby. We don't do any thrusting this way at all. And towards the third trimester and towards the end, we just use an activator instrument that is very gentle, easy on this area. We don't have them go on their side anymore and do what we call side posture towards the end because the baby is just uncomfortable and not good for the baby. So pelvis allows for the baby to loosen up, and that's good, but it puts way more pressure now also on these SI joints and again on the pubic bone. So we're working on helping that, getting that to function better. And yes, that's why we recommend the weekly visits, because the pressure's there. It's not going away until baby comes out. So it's important to keep getting aligned, keep helping that nervous system work better, keep helping the function work better musculoskeletally, and helping those SI joints, pubic bone, and then there's that overall strain of mom having to change the way things look at it. Final slide here. Obviously, I would do a whole lot of research. You probably already have. This is an era of research. Would you feel more comfortable in a hospital, birthing center, home, water birth, regular delivery? I was personally horrified the first time I saw stirrups. It's just me, old-fashioned guy, and after the first time doing it that way, my wife did do it differently. We have a lot of people that I've talked to recently that have had home births, water births, birthing centers. So look into that, make it as comfortable as possible. How the spouse can help. I said I'd do that. So one of the things that we teach is how a husband or significant other can actually work on these SI joints themselves. They're probably not going to have a pregnancy pillow to lay down that way, so we teach you how to do it sideways or on when mom's on her back, and actually pushing up on that. It relieves a lot of that low back pressure and labor pain, back labor pain, and we're happy to teach you how to do that. So, parting comments: pregnancy and chiropractic go hand in hand. We want to help pregnancies be as comfortable as possible, labor and delivery as comfortable as possible, and then this is from a slide that I did on another presentation, but just really quickly, that's why we recommend babies getting checked, because it's traumatic. You think about a 6 to 8 pound object coming out of a human being, that's just miraculous and amazing, also very challenging. So we check the baby's head, we check the baby's neck, very, very gently, about as much pressure as what I'm doing right here, just holding the baby. We don't do any popping, twisting, yanking, any of that stuff. Very, very gentle. We find out what's going on, help realign things and improve things so that the baby can be happier and function better. And if they're colicky in particular, if they're having difficulty pooping or digesting or sleeping, awesome time to bring them in. So we'd love your questions and comments. Remember, I want some comments on what your food proclivities or what you have different taste buds wise during pregnancy than others. And feel free to ask us any other questions and refer in your pregnant friends. And if you're pregnant yourself, come on in. Let's see how we can be of help. Thanks.